we have time for one or two questions. Yeah, Abraham.
Thank you very much for your presentation. I'm Abraham White, a local emergency physician. I would like to ask a question to Mr. Badenoch concerning the increasing judicial control on medical legal issues. Even though in this case in Montgomery, it has limited scope on informed consent. However, if we trace back the judicial history on the medical legal issues from Bolam to Bolifo, from Bolam to Sidere to Chester F. and then to Montgomery, it shows that the court has putting a lot of hands-on influence in determination of how should doctor behave and how should doctor work. Even though in Montgomery mentioned that the diagnosis or treatment should be left to the expertise of doctors, but I'm worrying that the court is going to impose a lot of control on how should doctor behave in those technical areas. Why make me concerned is that with a personal experience on expert witness, I noticed that the court has very much emphasis on the use of evidence-based medicine. Even though I confess that I'm a fan of evidence-based medicine, but there is a risk of over-interpretation of statistics. And very often, even though we are talking about RCT, randomized control trial, as a golden standard of medical studies, but very often these are all involving a lot of elimination of factors that may in fact turn up to be impacting the patient's individual outcome. So how would you see the trend, the judicial trend of court control on doctors' practice in the future? Thank you very much.
Is that working? It is working. You're right that the law is slowly but surely beginning to take more control of the practice of medicine so far as the definition of negligence is concerned. I have long been arguing that Bolam is inappropriate as the test of negligence because it in effect invites the courts to abdicate their judicial responsibilities. It sets the medical profession up as judge in its own cause. In no other sphere of the law, whether it relates to driving a car, designing a bridge, flying an aeroplane, building roads, whatever it may be, in no other area of human society do the judges abdicate any judicial responsibility and say, well, the decision about whether or not this was appropriate standard or whether the duty of care was breached is entirely up to a body of opinion from the profession. So I think, contrary to your fears, that it's the right approach, that the law should have its ordinary and normal function. Nevertheless, I am wanting to reassure doctors and surgeons in this sense that whereas I think the law is indeed in many, is moving away from Bolam application in its purest sense, namely if you can find a minority of doctors who approve it, then that's it. It's the end of the case, no negligence. Although it's moving away from that, the opinion of a body of doctors about whether this was a negligent act or not is going to be of the greatest importance, always, and will in many, indeed I might say most cases, be persuasive for the judges. So I don't think you need fear that the issues are going to be taken out of medical expert hands. It will merely be that approval by a body is never, in the future, won't be considered definitively the defense of a doctor. So, yes, you need be concerned a little bit, because hitherto the law has been extremely protective of the medical profession. In a way, it's not protective of any other, and in the future it will be less so. But in the end, reasonableness is the key, that a persuasive and strong defense by reasonable expert witnesses will probably prevail in most cases.
Maybe one more question? Yes, please.
Yes. Just a quick question, please. what would you say to the accusation that with Montgomery, doctors will be less willing to take risks, and consequently, there might be less innovation through practice. There might be innovation from research, but sometimes people discover new ways to new treatments through practice.
I think, if I understand you to mean that if the doctor is obliged to disclose risks to his patient, he will be less willing to take a risky course. That isn't quite what you meant. I don't myself see a danger in Montgomery in stultifying medical advance or medical innovation. After all, let us suppose you're intending to pursue a novel, but in your mind extremely effective but new form of treatment which hasn't been used very much. I would have thought that if that is what you're intending to do, and you think it's the right thing to do, your first course would be to make sure that it was discussed properly with the patient. After all, a novel or innovative form of treatment might find some lack of approval among responsible bodies of your profession until you've established its efficacy. And therefore, my answer to you would be that, in fact, Montgomery should hold no such fears. All it's saying is that a doctor in that situation who wishes to practice an innovative treatment, which might, in particular, for example, apply with an otherwise terminally ill patient for whom all other options have been tried and failed, the doctor might well think that the most important thing before he tried it was to involve the patient fully in discussion of the process upon which he wishes to embark. So generally, I mean, my message is one of reassurance to the profession, really. I've had to consider lots of points of the kind that have been made just now and by others in the UK. And by and large, I don't think you need fear this decision. I think essentially it brings the law into line with the professional guidance, which I read out from our GMC, which I think is very similar here. And it also brings the law into line with modern thinking. And if it's doing that, surely it can't be a bad thing. Society's attitudes should be reflected by the law. And indeed, often, as we know, the law creates or helps to build society's attitudes. I think, for example, the introduction of the breathalyzer for drivers, so opposed at the time, an infringement of our freedom, but has given rise to the acceptance generally that drink driving isn't a very good thing.
Thank you. I think we must stop because we have overrun a bit. Okay. Thank you very much, Mr. Badenoch.
Thank you. So there will be a short coffee break. Please enjoy your refreshment prepared at the foyer area. For mandatory students, yours were prepared opposite to the student registration desk. The next station will begin in 10 minutes. Enjoy. In the meanwhile, we would like to invite our distinguished guests, speaker, and members of this center to come to the stage for a group photo.